Welcome. My name is Dr. Terry Loftus, and you just started the Value Analysis Program. This is the introductory segment of the program. As you probably already figured out, it's broken up into 8 different segments, 8 parts, so to speak. And the reason is it's just to break it up, and the total program is about 3 hours and 45 minutes long. So don't feel like you have to go through the entire program in one sitting. I don't think it'd be worth it because I don't think you're going to be able to retain all that information if you did. So it's better to just break it up and look at it as 8 different segments, and it'll become a little bit more obvious as we get into the program why it's 8 segments total. But the first segment is introduction, and then the 7 segments that follow are actually part of a model, and I'll describe that model in the introduction here. So I'd like you to think of value analysis as something that is a little different than what you're used to seeing in most healthcare organizations. It really brings together a lot of different interests, a lot of different stakeholders. And as we develop the program and you start to understand how you can apply this to your organization, I think you're going to have a better understanding of how to extract value from everyday occurrences within your company. So it's as we go through it, it'll become more obvious. But value analysis is an important program that I think every healthcare system and every hospital should really pay a closer attention to. So how did I get involved in value analysis? I was working as a chief medical officer, and our organization was looking for somebody who could help them in the supply chain area. And the reason is because supply chain is the second biggest expense within an organization. The first biggest expense is basically the people. Trying to keep a staff of nurses and technicians and physicians and administration is pretty costly for hospitals and healthcare systems. But the second biggest cost is supplies. And as we started looking at our supplies, we realized there's probably a lot of opportunity in there. And they wanted somebody who had a background in surgery, also somebody who had a background in business. So I had an MBA, and I was working as a chief medical officer, and I worked as a surgeon prior to that. And so I sort of had all of the components necessary at that time, and I literally that's how it happened. They gave me a call and said, "Would you be interested in doing this?" And as soon as I got into it, I began to realize this is something very different. I had never done this before, and so what I hope to give you is kind of a template for how to do it. I look at this as I wish I had this when I started on day one, because it wasn't real obvious to me exactly how to do this, and it took a few years to really get it up and running. But once I was able to do that and go back and look at it, I began to realize this is something that you can plan out. This is something you can learn in advance prior to throwing yourself into a value analysis program. So hopefully you'll be able to get I'll be able to pass on that education to you so you understand how to do it without having to make all the mistakes that I made along the way. The other part is it has to do with a hypothesis, and a lot of this happened when I was working, looking at robotic assisted surgery, and we were looking at some of our data and realized that parts of our organization, hospitals that had better outcomes, tended to have more organized structures, not just a little bit, but very highly organized structures around the program and the approach to robotics, whereas those that had no programs really didn't do this. And we started looking at this in terms of where else is this happening, and began to realize this is actually an important part of program development. So it just doesn't apply to robotics. In fact, actually, I would say it really applies to value analysis, and you'll see some other programs out there as well. But as we go through it, understand that a structured value analysis program with specific defined elements produces as good, if not better, quality at a lower cost than a relatively unstructured program. And so unstructured programs really are just that. There are people who think they have value analysis programs, but they haven't put a lot of structure behind it, and they're not understanding why it's not performing in a way that they would like it to. And so I'm going to show you how to get structure into your program, and then how to get the performance that you've been expecting out of it. And hopefully that'll make your organization much more competitive and also more value driven. So what is value analysis program? I've been talking about it for the last 5 minutes and really haven't defined it yet, but it's a facility or system-based program which is designed to review clinical products, equipment, services, and technologies to evaluate their clinical efficacy, safety, and impact on organizational resources. And I just adapted this from a definition provided by the Association of Healthcare Value Analysis Professionals. And if you've never heard of this organization before, I strongly suggest you go check it out. There's their website address right at the bottom of the page there. But I found them to be especially helpful. I joined the membership is something like $100 a year or something. I think it's a great place for physicians, nurses, and supply chain personnel who are involved in value analysis to go and become a part of. They have just a huge amount of information that's available on their website. And as a member, you get access to a lot more information. Not only that, be able to network with other people who are like-minded, who are doing the same thing for their organizations across the country. So it's kind of nice to have people who've been through this before and getting their input. So I strongly recommend that you take a look at the website at the very least and really consider signing up for it, because I think they have a lot of resources that would be helpful for your value analysis program. So you have to understand, though, the program is the overarching structure, whereas a value analysis committee is the formal executive arm. And sometimes we get a little confused with those two. And as we go through this program, you'll begin to understand sort of how committees play a role in the program. But there's always going to be a formal value analysis committee that's really the executive arm. They provide oversight in determining how that structure is integrated into the system and how it performs. And we also have a big section right at the end on performance improvement. You'll see how part of the reason why a lot of organizations struggle with value analysis is because they don't know how to design their performance improvement or how to track it. Value analysis teams are the subgroups that may be used by a program to obtain insight from subject matter experts. So they may pull in people. So a lot of times everybody thinks, well, how many doctors are we need to get involved in this value analysis program? Well, the actual executive arm isn't going to need a huge number of physicians on it. It's when you get into teams that you're now going to have to pull people in. And I'll show you how to do this in a way that's a lot more cost effective, meaning getting people involved in these teams is actually pretty easy, because a lot of physicians are already interested in these products and really want to have a say in how they're introduced or not introduced into their healthcare system so that they work in. So you want to keep that separate, because the two, it's everybody thinks that you need to have this huge committee with 50 members on it, and don't do that. That's a big mistake. Keep that as a pretty small, very formal executive arm, and then create teams as needed on an ad hoc basis. So the structure is, I think, is primarily composed of 7 core elements referred to in this program as the 7 pillars, and it's exactly what I discovered with these other programs is they have a lot of things in common, meaning successful programs all start to look like each other in their structure. And it doesn't, when you first hear that, you think, oh no, there's got to be something different because they're different programs, and there is. There's how you apply each of those elements. But the 7 elements are pretty basic, and they're pretty straightforward. And in a couple slides, we're going to take a look at each of those. And as we go through this program, we're going to go into each one in depth and show you how to take those 7 elements and build them into your program. So what are they? They're higher level elements that differentiate successful programs from unsuccessful programs. If you have these, you stand a much greater probability of having a successful program. If you don't, you stand a much higher probability of having an unsuccessful program. So you're really going to want to build them in. They are the foundational structure for a successful program. So if you want to have success, you're going to want to have that structure. It's kind of like if you want to have a house that's going to be able to withstand a storm, you're going to have a strong foundation. Well, build that foundation on good, sound structures, and what happens is you're more likely to have a better program. So it focuses leadership on the organizational elements required to build a successful program. What happens a lot of times, particularly if you just get thrown into this, I literally got thrown into it. It was just like, okay, we're going to start a value analysis program. How do you do this? I really had no idea. I had to do an enormous amount of research on this and talk to a lot of different people. But in the process of doing that, I made a lot of mistakes. And what I hope to do with this program is to point out where I made mistakes and where I had successes, and how you can avoid those mistakes and how you can focus on the success. And by doing that, I think if you focus on the elements that I'm going to talk about in the program, you'll be more likely to have success. The other thing, keep in mind, this is transferable from program to program. Like I said, this originally originated out of a robotics program, but I've since applied it to a clinical practice program and then also this value analysis program. So if you learn the skill set in this program, you can apply it, I think, to just about any program out there. I don't think you have to go out and do a special course. I've written books on all of these programs. I'm also doing the whole online courses with them. but I think once you do one of them, I think you're pretty much going to know how to do it. You really don't need to come back and buy another book or sign up for another program, because I just think that once you get it down in one program, you'll be able to transfer it to other programs. I think it also helps healthcare leaders become successful. It gives you a useful skill set, produces better quality, improved utilization, cost savings. So, let's face it, a lot of people in healthcare move around quite a bit. And so if you go to another organization, you now can bring this with you. It's your skill set that you take with you in terms of program building. And having success at that is not only valued by other organizations, but I think it's also going to be, you're going to find it valuable in terms of your own ability to be able to impact the environment you work in. So this is going to become useful not just for your organization where you're at right now, but for you personally, but also for wherever you end up in your career. So what are they? 7 pillars, all right. Purpose, engagement, communication, infrastructure, accountability, leadership, and performance improvement. And through the rest of this program, this is the introduction segment of this, but for the next 7 sections of this program, we're going to go into each one of these, and we're going to cover them in quite a bit of detail to show you how to build these into your program. If you look at them, they have the mnemonic special PI. It stands for 7 pillars, and then the first initial of each of the words in the 7 pillars. And so I think that's something to be helpful in terms of when you're sitting around and someone says, "Well, how do you plan on building this program?" You say, "Well, I'm going to build it off of these 7 elements." The purpose, engagement, communication, infrastructure, accountability, leadership, performance improvement. You can do that right off the top of your head. And people are going to be like, "Wow, this guy knows what he's talking about," or, "This woman really gets it," That's what you want. You want people to be able to do that. Not only that, but it helps you sort of organize it in your head. When someone presents to you a problem, what happens a lot of times, particularly me, I get people approach me all the time and ask me different questions, and I just do that in my head. I go, "Where's the problem?" And a lot of times I inevitably find out that there's something missing in one of these 7 elements. And so here they are. I'd read them off for you, but you could read them just as well as I can. But I'll go into each one of them in a great bit of detail and show you how to build them into your program. So if you have any questions or comments or suggestions for improving this program, feel free to contact me, Terry LoftusMD at gmail.com, or you can go to my website, www.loftushealth.com. Either way, you'll be able to get a hold of me. There's a contact form in my website, but the easiest way is just do it straight through email. And you'll see the slide at the end of each of the segments, so if you feel like I passed through this pretty quickly, don't worry about it. You'll see it again, and feel free to contact me. And with that, we're going to move on to the next section, which is purpose. Thank you very much.